welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, many recent advances in the treatment of heart failure has focused on device-based therapies. Pacemakers and implantable cardioverter defibrillators are used to treat heart rhythms in a broad range of patients with heart disease. So to discuss on this, we are being joined today by Dr. BARUAH, cardiologist from Apollo Hospital. So not to waste any more time, I'll straight away move to BARUAH to talk more on the topic which we have taken today. Well, thank you so much, Doctor, for joining to Good Life, the health show at this point in time. And today the topic which we have taken must be a question in everybody's mind when we talk about heart failures. Now, Doctor, if we talk about the generic knowledge about heart failures, what would be that? We would like to start with it.
Yeah, first of all, thank you and good afternoon to everybody, including Pooja and the audience. So today's discussion is on heart failure, and then heart failure is a sort of disease where patient symptoms are breathlessness and then unable to lie down, and then there will be swelling in the legs or in the face, and these are certain kind of symptoms. And then the dreaded condition that we are scared of is that patient can develop pulmonary edema. That means the whole lung is flooded with fluid, and that can lead to catastrophic event, and then even patient can collapse. So this is called heart failure, and the major problem with heart failure is that the heart pumping is becoming very low, and then as the heart pumping becoming low, and then the fluid gets congested in the lungs, and then that is the reason why the patient develop heart failure.
All right, Doctor, today we are going to discuss on device therapy. Now, device therapy has increasingly become an essential if we are talking about the management of clinical heart failures. So what would you like to tell on that?
Yes, once the patient on medical therapy, and then even after good medical therapy, the patient is not responding to heart failure management, and this patient actually falling in the category of very advanced heart failure, and then not responding to the routine or usual medications, and then we suggest device-based therapy to this group of patient. And there are most importantly that we used to talk about the cardiac resynchronization therapy. We call it the CRT, and the CRT comes in two basic packages, that is called the CRT, that is plain cardiac resynchronization therapy, that particular device, and then sometimes it is combined with an ICD, and then we call it as a combo device. So the CRT plus ICD,
absolutely,
we call
Doctor
combo device, and if the CRT plain, so this is cardiac resynchronization therapy.
Yes, Doctor, will come to the elaboration and a proper discussion on the device therapy, but right now we have a caller at this point in time. Let's take the call and then we'll proceed with the conversation. Hello.
Yeah, hello. মই গুৱাহাটীৰ চামালৰ পৰা কৈছিলোঁ ডক্টৰ, মানে হাৰ্ট ডিজিজৰ ওপৰত এটা জানিব বিচাৰিছিলোঁ যে আমাৰ যোনটো লাইফষ্টাইল এতিয়া যোনটো আমি জীৱন যাপন কৰোঁ তাৰ বাবে আমাৰ মানে হাৰ্টৰ বা হেৰিৰ ওপৰত বহুত প্ৰেছাৰ পৰে বুলি শুনো। সেইটো কিমান দূৰ মানে আমাৰ লাইফষ্টাইলত কেনেকুৱা ধৰণৰ চেঞ্জেছ আনিব লাগিব যাতে মানে হাৰ্ট ডিজিজৰ পৰা দূৰত থাকিব পাৰি?
Lifestyle modification is very important কারণ যদি লাইফষ্টাইল মডিফিকেশ্যন কৰা নাযায়, ফৰ এক্সাম্পল পেচেণ্টৰ প্ৰপাৰ ডায়েট, সুষম ডায়েট যদি নলয়, আৰু যদি পেচেণ্টে এক্সাৰচাইজ নকৰে, তেওঁলোক অবেছ হৈ যায়, আৰু এক্সাৰচাইজ নকৰিলে মাছলছবোৰো তাৰ টোন এণ্ড ষ্ট্ৰেংথ কমি যায়, আৰু বিভিন্ন ধৰণৰ ৰিস্ক ফেক্টৰ্ছ, উই কল ইট এনৰিচমেণ্ট ফেক্টৰ্ছ লাইক স্মকিং, high cholesterol, diabetes, uncontrolled diabetes, hypertension, and also importantly amar ajikali stress level to job related stress or psychological stress বা physical stress ebur jotheshtokhini beshi hoise. Pollution is another factor. So this modification of the risk factors or enrichment factors actually having a great impact on the cardiac diseases. So ami definitely modify koribo lage, tetiahe heart disease war sambhavana komi jay.
All right. Thank you so much for calling at this point in time. I'm sure the answer which just doctor gave you must be benefited to you. And well, viewers, the numbers are flashed on your television screen. So if you have any queries regarding the topic we are discussing at this point in time with Dr. RITUPARNA, cardiologist from Apollo Hospital. So don't waste any more time. Our numbers are flashed, and please call up and ask your questions. And I'm sure doctor will be able to give you all the answer. But doctor, coming back to you again, we were talking about CRT. You were talking about the device therapies which is needed for the heart failure patients. So what do you have to say on that?
CRT means the cardiac resynchronization therapy. Jodi ami bujhabole jaun, so we try to understand people to and then what happens in heart failure, the heart muscles become weaker. And the heart muscles actually cannot pump effectively blood into the circulation, and this patient particularly suffering from hypoperfusion syndrome, and then there is less blood flow to the kidney and the brain or the liver or other vital organs, and that can cause different adverse effect. So basically this is a device. This device is connected with three cables, three leads we call, and that it goes to the different chambers of the heart. One lead goes to the right upper chamber, another lead goes to the right lower chamber, and the third goes to the left lower chamber, kind of things. So it is it's a different this is a synchronization of the heart muscles contraction, so that if all the heart muscles contract synchronously, and if it maintain a synchrony, so it can effectively increase the cardiac output. I mean the ejection fraction, that means the stroke, the volume, but the pumping capacity of the heart will improve, and thereby there will be more blood flow effectively to the circulation, and the vital organs will get adequate blood supply for its function to maintain. So now, that is why we call it the cardiac resynchronization therapy, resynchronizing the muscles of the heart.
All right. Now, doctor, if we talk about the stages, now does everything depends on the stages or the type of heart failure? Do anything such happens?
Yes, there are 4 stages, and start with the risk factors like hypertension, diabetes, and then coronary artery disease. Once the structural heart disease takes the start in, so we call it the stage B, and the patient develops symptoms like heart failure symptoms like breathlessness or swelling in the legs, unable to lie down, and there is increased fatigability, tiredness will increase. So these are the symptoms, and the stage 3, and the stage D is the advanced stage where we need a specific form of pharmacotherapy or kind of device therapy like CRT or cardiac transplantation, so that effectively we can improve the heart pumping. So there are different stages of heart failure, and they start with A, B, these are the initial stages, and the advanced stages are C and D.
All right, doctor, we have a caller at this point in time. Let's take the call. Hello.
Hello. Sir, more eta proshno asile. Ami etia mane jehetu working mahila puro karone work life balance to mane okoman mushkil hoy jay, mane difficult hoy eto. So apuni amak ki advice dibo paribo, mane so je ami keneke mane amar swastho to maintain kori rakhibo paro in terms of mane heart and all mane.
Yes, basically the ladies are protected by the estrogen and other hormones, natural hormones. So what happens once this age increases and they receive menopause, and this protective effect of the estrogens waning off, and the patient can develop different types of diseases, like also risk factors like hypertension. They can develop diabetes and the cardiac diseases. So the importance is we have to keep a balance between the work and the physics. So you need to do regular exercises to keep your muscles strong, and then to increase your fitness, physical fitness, and then what the type of diet you are consuming, it should be very balanced diet. There will be less of carbohydrate or fat containing food, more of fiber food, and we always advise to adopt a DASH diet, so dietary approach to stop hypertension, when there is less of salt, more of nuts and potassium containing food, fruits and vegetables. So thereby we have to keep a balance between the job and the physical strength, stamina and fitness.
All right, thank you so much for calling at this point in time. And now, doctor, coming back to you again, if we talk about the sequence of the treatment, sequence of the device therapy, now, if any patient who has gone through a heart failure, now, what is the first thing a hospital, as a doctor, you proceed with for the device therapy?
The most important is that we have to stabilize the patient. Clinically, the patient has to be stable. All the heart failure symptoms should be stabilized, like the shortness of breath or edema. If the patient is overloaded with fluid retention, so we have to give medications to remove the excess amount of fluid, and thereby we see the different whether this particular patient or individual falling into the indication of the device therapy or not. I mean that. This cardiac resynchronization therapy. So there is some clusters of parameters that we always used to see and assess before implanting this device. So otherwise, if this indication deviate or the patient is not falling into the proper indication, so there is every possibility that the patient may not respond to this cardiac resynchronization therapy. So this is an expensive device. So we have to be very careful and sure about these indications and contraindication of implanting this device.
All right. Now, doctor, on this note, now a lot of question arises in a patient's mind and also to the attendants. Now, if we talk about the technology, it has already advanced so much that all the latest equipments are there in the several hospitals. Now, if we talk about the proper counseling to the patients and also to the attendants, do hospitals do that before applying them or before advancing them for the device therapy?
Yes, I do, or my team members used to do a lot of counseling before implanting this sort of device. We need to talk about the benefit and the risk of implanting this device, the risk during the procedure or implanting that electronic device, and then in the follow-up also they have to be very stringent on regarding the follow-up of this patient, and we keep on checking the different device parameters and the ECG and the echocardiographic assessment whether the patient ejection fraction, I mean the pumping, being improved or not. So and at serial intervals like monthly interval and 3 monthly intervals. So right from the starting before implanting this device and also monthly interval, maybe 3 monthly interval, we keep on checking the different parameters of the device. These are very, very important aspect of device implantation.
All right, doctor, we'll have more conversation on the topic which we have taken today, but right now we'll have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion with Dr. RITUPARNA, cardiologist from Apollo Hospital. Now, doctor, coming back to you again, if we want to know about what is CIED, what is the full form, what is the process or the functions of CIED, what would be that?
CIED means it is cardiac implantable electronic device. So what we talk about the CRT, that is cardiac resynchronization therapy, and you know about the AICD, we commonly call it ICD. So it is a device basically in heart failure patient. There is every possibility that this patient may develop some kind of lethal arrhythmia. So lethal arrhythmia means that the heartbeat suddenly goes very fast, and then patient can develop dizziness or loss of consciousness, and that patient can pass away, and then the patient can collapse in cardiac arrest, and even death can happen. So this is heart failure can lead to this kind of sudden cardiac death. So there is this device ICD is implanted subcutaneously, and then the cable goes to the heart, and it can generate a shock. So electrical shock can be given at that moment when the patient develops this lethal arrhythmia, and immediately within second that lethal arrhythmia can be converted to normal heartbeat. That is why we can prevent. That is how we can prevent the sudden cardiac death and sudden cardiac arrest. So these are called the cardiac implantable electronic devices.
All right, now doctor, the pacemakers, which generally is being used the term, so the pacemakers and the CIED, is it totally different or is it something related we are seeing?
Pacemaker is also a sort of CIED, so
Okay.
it falls into the same category only.
Okay.
But there is a pacemaker is implanted for bradycardia. So when the patient heartbeat is becoming too low to sustain life, and then there is less of perfusion because of the low heartbeat, and patient can develop syncope or sudden loss of consciousness. So the pacemaker is implanted for bradycardia, means lower heartbeat. So this is a difference. So
Okay.
here we talk about the heart failure devices. So this is
Okay.
basically
So this is
CRT
totally
and
different.
ICD.
Okay.
But
now, doctor,
both all of them, yes, but all of them is falling into the same category only, CIED.
all right. Now, doctor, if we talk about the restrictions after putting these devices, what would be the restrictions? What do you suggest the attendance of the patients?
Yes, the restrictions are immediately after the implantation. The most important is that if the patient is diabetic, so
Okay.
we need to control the sugar within normal range. This is very important. Second is that we have to prevent all the necessary steps. We have to take all necessary steps to prevent infection, because this is a foreign body implanted into the heart, and then there is every possibility that if we do not maintain a proper hygiene, and then this device or that cable inside the heart can get infected, and then and there will be other catastrophic problem. So, and then third is that the patient need to restrict certain activities, like they cannot move the left limb for certain period of time. For example,
Okay.
if we implant the device on the left side, so or right side accordingly, that part should not be moved too aggressively for a particular time, for example, maybe a month time. So after that, there should not be any restriction. And then those patients who want to use mobile or other devices, so it is advisable to use the Android devices, and then the other side of the implanted area. For example, if the device is implanted on the left side of the chest, so they are suggested to use mobile from the right side. So these are some of the limitations, but these limitations remain there for a very short period of time, and after that there are minimal, the limitations are significantly low.
So, doctor, now how long this entire process takes, and what about the thorough checkup and also to see doctors after the implantation is done?
Yes, once this device is implanted, and then we need to check the parameters, and we call it there are different programmable parameters in that particular device. So we need to we keep on checking these parameters within the desired level, and then we need to check the heart pumping, ejection fraction that we already discussed. By echocardiography, we can check the heart pumping capacity, whether it is improving or not, or it is remaining same. And also important is that the clinical manifestation of the patient, whether the symptoms of tiredness or other heart failure symptoms like the fluid retention or breathlessness or tiredness, whether these are improving or not. So we call it the NYSEC class. So different classes, and accordingly we keep on assessing these symptoms. And also important is that whether there is any chances of infection, or whether the wound that we created for device implantation is healing or not. So this is how we keep on checking the patient in different follow-up. Usually we do the procedure. The procedure time is around maybe 1 hour to 3 hours per hour, depending on the complexity of the anatomy.
Okay.
And then we ask the patient after 4 or 5 days, and then this wound has to be healed. So accordingly, we need to do dressings, and then we call the patient at regular intervals, like maybe a 5 days or 7 days intervals.
Okay.
So that particular patient has to come to the hospital or to the device clinic maybe 2 or 3 times, and after that we ask the patient for a monthly interval for 2 to 3 times, and there are 3 monthly and 6 monthly follow-up. This is how we actually do the follow-up in device clinic.
All right, so this was all about the follow-ups just after putting the device. Now, doctor, as we know that the lifestyle has changed completely for everybody, so as cardiologist, what suggestions you would like to give to our viewers who are watching our show at this point in time?
Yes, lifestyles is important, whether the patient is suffering from coronary artery disease, blockage in the heart arteries, or the heart muscle becoming weaker, we call it heart failure. So whatever the disease the patient is suffering, but that patient has to adopt a very good lifestyle. And then if the patient is diabetic, need to control the diabetes, particularly the diet and the exercise. And we emphasize more of yoga and pranayam these days. And then we already discussed about the DES dietary approach to stop hypertension, because hypertension, high cholesterol, these are the one of major risk factors of causing different cardiac diseases. So and then regular intake of medications, and then the exercise, weight reductions. We have to consume a lot of fiber food, green vegetables, and dead fruits. So this is how we maintain a good life, and also consumption of oil. So we endorse consuming olive oil and along with the mustard oil, and keep on rotating this oil so that we get all the antioxidants this oil contain, and the omega-3 fatty acid and the other nutrients which are very important. So that is how we maintain a very good lifestyle.
All right, very informative.
And also important is that cessation of smoking.
Yes, please continue.
Yes. Yeah, cessation of smoking, and then this high calorie food also to be restricted. So this is how we maintain a good lifestyle to prevent cardiac diseases.
All right, so a lot of informative suggestions out there for the viewers who are watching our show at this point in time. Really, device theory has become an increasingly essential thing to the heart failure patients out there. Thank you so much, Dr. RITUPARNA BARUAH, for joining To Good Life, the health show today, and giving those valuable suggestions to our viewers who have watched our show. And well, viewers, with this we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.